Okay, Gloria, go right ahead.
Thank you everyone for coming today. Next month will mark a year since I stood before you to announce closing of schools due to the COVID-19 pandemic. Since then, we as a school family have been learning and growing along the way, and together we have overcome enormous challenges. We want all of our families to know how much we appreciate their support over the last year. We are grateful for our collaboration with local health officials and the UW-Madison scientists, Madison Teachers, Inc., and all who have provided invaluable information to ensure our decisions were grounded in safety. I also want to elevate our partners, nonprofit organizations, the city and county, and private sector who stepped up in many ways to support our students and families to get us through this health crisis, from food access to donations of masks, rental assistance, and so much more. We witnessed the strength and resiliency of our community. We have learned so much during this crisis, highlighting the continued racial disparities in health, education, and economic stability. And we know that we can't go back to how things were, but instead do a hard reset as we enter the new normal for all students and families. As we move through our reopening plan, we understand families will have many questions, and it is important to us that we provide as much information as possible to make sure families have the information they need to make the most informed decisions possible for their learners. There will be a great deal of information being provided in the upcoming days, and we encourage families to visit the MMSD school reopening page found on our district website. Here you will find details on what the phased return to our school buildings will look like. And before I hand it over to Dr. Jenkins, as president of the Madison School Board, I am incredibly honored to have served with my fellow school board members during this crisis. Their leadership, strength, resiliency, and connection to community led us through these challenging times. And on behalf of the Board of Education, I want to thank Superintendent Dr. Jenkins for his leadership in jumping in without skipping a beat in the middle of this pandemic. And to all of our MMSD staff for the hard work to get us to this place today. We recognize there is no plan that will satisfy everyone, and your work has the district in a place today to return our students in the safest way possible. So with that, I will now turn it over to our Superintendent, Dr. Carlton Jenkins.
Okay, Ms. Reyes, thank you so much for that, those kind words to our community. And I just would like to tell you thank you to the entire board for your support and trust of our staff during these very unprecedented times, as our staff have continued to work behind the scenes to get our students back to the classroom. And at this particular time, I would just like to say to our community, we're so grateful for their support, the grace and understanding of our students, staff, families, and community during these unprecedented times. As part of our commitment, we will continue to refine our virtual learning instructional delivery model and pay close attention to the socio-emotional well-being of our students, staff, and families. We know that people are hurting during this time, but we really do appreciate all that you're doing. Thank you for your continued partnership as we navigate these challenging times. Keeping with the letter that we sent out on January 8th, we announced then the possibility of implementing our plan of coming back during third quarter if the COVID-19 conditions improved. Our current COVID-19 metrics, based on information from Public Health in Madison and all of our other partners looking at the Center for Disease Control and Prevention, we're finally at a point where we feel like we can have a safe return to our school buildings. In addition, the guidance we have received from our local health experts, many of them are our parents, and supporting us implementing a phased approach to coming back to school. That's why we're here today. And I'm very proud to say, as superintendent, we thank everybody for what they have done. And that's why we're here today. We're looking at a safe reopening plan that will begin to bring our students back to our schools. At this time, I'm going to turn it over to Mr. Lamons because I know that there are a lot of questions that individuals want to ask. And I also would like to say thank you to the media, as you have also been there for us, supporting, getting the message out to all of our families. We are going to take other measures, though, to make sure that we reach all parts of our community with this reopening plan. We're also going to have surveys coming out to you next week. It's so important that everyone please fill out this survey indicating your desire to return in person or to remain virtual. Either way, as a district, we're going to be committed to ensuring the reopening goes off without a hitch, and the virtual learning, we're going to continue to refine our practices. Thank you so much, Mr. Lamont.
Thank you, Dr. Jenkins, and welcome to all of our news media partners in the room. Just going to go over the format real quickly for those of you who have not participated in an MMSD news conference. We're going to ask individually each reporter to ask a question and ask all of their questions at the same time before moving on to the next reporter. And then at the end, when we work through that list, I will come back and ask for any follow-up questions. So with that, we'll start with the Wisconsin State Journal and Beth Byer.
Great, thank you so much for taking my question. So is the district concerned about the new, more transmittable variant of the COVID-19 virus that has been detected in Wisconsin? And was this taken into consideration when planning to reopen?
Well, first, let me say this, and I'll remind everybody, we are in the middle of a health crisis, more than just a school crisis. So we do have our medical advisors here with us on this particular call, but just as superintendent and as a staff, we were definitely concerned about the second strand that's coming along. But listening to our medical advisors, we feel pretty confident that at this time, we could have Dr. Wall or Dr. Henderson, those are the two medical advisors, speak to that.
Hi, this is Ellen Wald, and what I would just say is that while the variant has been of some concern, this sort of a mutation has happened even earlier in the pandemic, where there has been a shift from one strain to another. The mitigation measures that are important in preventing spread are exactly the same for the original strain as for the mutant strain. So we feel that all the precautions that we've set in place are sufficient regardless of which strain is circulating.
Great, thank you. So my next question, so the district's COVID metrics were not yet in the green in regard to staff training. So what efforts are being made to train staff in COVID-19 mitigation?
Beth, that's a great question. And what we have done, what we said in the January the 8th letter, that when we announced we're going to give ourselves at least 3 weeks to make sure we could bring staff back in appropriately, communicate out with our families about what we're doing. So that's what we're going to be doing. We've been working on this for months. Right now, it's coming up on almost a year. And as we went into closure, we began to think about reopening right away. So we have put all of the strategies in place. We're going to be doing different professional development for our staff to make sure that they are very much aware and practicing these strategies that can help us mitigate the spread. We have a strong response plan for anything that may happen. We've also learned from our MSCR that's been in place. Ever since we closed, we've had staff in, and we've learned a lot as we have had to close some of our MSCR based upon trying to ensure that we had the right practices in place in responding to some potential positive cases. We also have had our staff in place providing special needs services to our students. So we have learned a lot from this time that we had off, and also looking at other school districts and trying to just be as relevant as possible to ensure that we can have a safe return.
Great, thank you so much. And last question, 95% of instructional and support staff are needed to implement hybrid in-person learning according to the district's reopening metrics. So right now, what percentage of staff are able to return and what percentage are comfortable with returning?
Well, I'm going to answer that question that in terms of our staff, we're expecting everyone to return. But of course, just like any day, minus COVID, staff have different reasons that they may have to take a leave or something like that. So, but at this point, we're anticipating all of our staff coming back. As individuals have their situations, they will work through HR. And I will have our HR person also respond to that. And if Mr. Wadey or Mr. Skolasky is on the call too as well, they will respond.
Thanks, Dr. Jenkins. I think you answered the question, but I'll just restate it again. It is our expectation that our staff are returning. We're excited for folks to return to buildings. If there are folks that have specific issues that would prevent them from returning, they will have the opportunity to connect with human resources and have the support that they need to work through those processes, whether it's a medical leave or an accommodation, et cetera. But at this point, we're just really excited for our staff to be able to return, and we're expecting them to all return, and our HR team is standing by to support them in any ways that they need.
Do you have any other questions, Beth?
Nope, that's it. Thank you so much.
All right, thank you. Next, we'll go to Scott Gerard with the Cap Times.
Thank you all for taking our questions today. I'll actually build off of Elizabeth's question there. Last month, before the third quarter decision was announced, MTI released the results of a survey it had done that showed, I believe 94% did not support reopening at that time. Are you concerned about teacher potential opposition to this plan?
Not at all, Scott. What we've done throughout this process, we've included MTI, we've included the administrators, the APP group. We've had internal, external support as we've moved along with our medical advisors. And the report that you had initially from MTI, that was based on the question that they had put out. And I could say, hey, those responses were directly correlated to that question. We had another survey that we had to ask that was a different question. And individuals have brought that up about it was different level of response, individuals indicating that they could return. But nevertheless, we've been working through the process, been taking the questions from our staff, working hand in hand. And that's why even today with MTI being here, they were there this morning. I met with the principals, I met with the building representatives, and we're talking. We still have questions. People have questions, but we've committed to go through this together.
All right, and to go off of that, can you detail how MTI was consulted on this plan? And if Andy is here, is MTI in support of this plan?
At this point, I would like for MTI, they could speak for themselves. I think they may be on the call today. I'll just give you the high level. Everyone has been invited to the table. MTI, they've been there as a part of the planning, giving recommendation. And to be quite frank, I've learned from all the individuals, not just the medical advisors, but MTI, the APP, other parents. And so more directly, they can speak for themselves in terms of how they feel like their level of involvement has been there. But even today, with our principals and our building reps in the room, in preparation, not only for this press conference, but reopening, we're going to work together hand in hand all the way through. And I'm certain that MTI and APP want to have our students back in school, our staff back in schools in a safe manner. None of us want to be in school if it's not safe for all of our people.
Do we know if MTI is on the call at all? I wasn't sure if I should wait.
No, they are not.
Okay.
Okay, they're not. Okay.
I'll reach out to them separately.
Thank you.
I guess more broadly, can you share what has changed in the month since you announced third quarter would begin virtually?
We've been following carefully well, first of all, internal and external advisory has come together. We've been monitoring this closely because we know the significance of this. This is serious. This is a health crisis. So we had talked about one of the mitigating strategies to follow the metrics and see whether or not we were going to have a trend downward to get to 5% 4 weeks in a row. And as you're watching the Department of Health, their release, right now we're about 2% when we start talking about that spread in our community. And that's way below the 5% we had talked about. And that's even including a 1+ % increase with UW with the students even coming back. So that's healthy. The other things that we had on our punch list to get through to turn our dashboard green, many of those things have happened now. In fact, our dashboard looks, when you look at it, you're going to see all the green on it. We had one area that was red, but that wasn't necessarily because of something not happening. It was a change, if you recall, from the Department of Health in terms of the metrics that they had set out that we were following. And then once they changed it and gave it back to the local to make that particular decisions, we continue to go with our dashboard. And so for us, we're real confident. Now, we've also had an opportunity to learn from our MSCR program. Well, at times, I mentioned it earlier, we had to close down some sites based upon some of the mitigating strategies we needed to put in place. But we've learned from that. We've learned from our peers on a local level, on a national level. And so we're pretty confident in terms of our move forward. If you've been paying attention to Dr. Fauci, Dr. Schaffner at Vanderbilt as well, and Dr. Joseph at Harvard. And then more important for us, we had our own local medical advisors, and they're here too, and they could talk about some of the changes from what happened in August to what happened now and what happened in November to now. So our medical advisors, if you want to speak to that too, what has changed since November?
Hi, this is Ellen Wald again. Okay. This is Ellen Wald again, and what I would just say is that beginning in September, there were many schools nationwide that did open, and I think the publication of those experiences has now been shared with others. And we have read and been very pleased to learn that experiences in Mississippi and in North Carolina, and even in our own Wood County in northern Wisconsin, have shown that even when the community rates of infection are very high, spread within the schools is very low, as long as you can maintain those mitigation processes. And, again, we're committed to maintaining those mitigation processes. And with that understanding, the distancing, the mask wearing, hand sanitizer, commitment to really observing all of these things scrupulously, I think would allow us to feel comfortable that this is a good time to open our schools.
All right, thank you. So I know next week you mentioned the survey that will be sent to parents. Will they be able to opt in to in-person later in the spring, or is their decision in this initial survey a final decision for the remainder of the school year?
No, one thing we've learned for sure, we have to be able to pivot, but be intentional about pivoting. And so families who may opt out initially, as we have learned, they may learn and become more comfortable. One of the things that we understand, we have different situations in our community. We have different family dynamics and whatever worked for our families, but we're just asking, once they choose to opt either to come back in person or to go back virtual, we're gonna have a time for which we can actually do that. And right now it's been like a grace of 3 weeks that we've talked about to make the necessary logistical changes that we would have to make.
So just to make sure I understand, so if they chose virtual, but later in the spring, there might be a time where families would have another opportunity to reconsider that, and you all would adjust with about a 3-week window.
Yeah, right now it's at a 3-week window. We're still going to study that because the logistics behind this is just a huge part, and we have to have some cutoff times to be able to do it well, not just fast, but well.
All right, thank you. When will staff be returning to buildings to set up their classrooms ahead of the reopening?
What we wanted to do is start our classrooms for instruction on the 9th. And we're going to have an asynchronous day starting in the district. We're going to be changing that. And that's in the letter that we sent out as well, starting on the 8th. And we are backdating that to give staff approximately, and I say approximately 3 weeks to begin to make that transition with their building leaders. And buildings are different based upon size of building and all of that. So this morning when I spoke to the principals and to the building reps, I told them that we're going to have a local decision of how they bring them back. Starting off with kindergartners, we know the elementary right now, what we're doing, we're looking at our primary schools and we're working on our plans to for our middle and high schools.
All right, thank you so much. As far as teacher vaccinations go, the Tier 1B is expected to begin around March 1st. How is the district going to prioritize vaccines? Will teachers in these grades that are returning be given priority? And do you anticipate those staff members having the vaccine by the time they'll be in person?
Scott, I'm going to have Jay answer that, but one of the things I'm going to need you to do for us, I need you to advocate that we can get all of our people who are back in person, our kindergarten teachers, our custodians, all of the people who are coming back. I need you to help us with that. In your article, write it to the governor, write it to the legislators and tell them that the individuals who are coming back, we need the support in getting that vaccination. Now, I'm going to have Jay respond to, that's just Carlton D. Jenkins personally saying that to you. Everybody's a partner in this, and I need you to help us on that piece. I appreciate you doing that. Jay, if you could respond to that, please.
Sure. Thank you, Scott, and thank you, Dr. Jenkins. I just want to underscore, following DHS and public health guidance, we've moved all of our staff eligible for Tier 1A into Tier 1A, and they're working through the process of getting their vaccinations currently. As Dr. Jenkins mentioned, this does not fit our district priorities, and we've had essential workers in person throughout the pandemic that are still waiting, and that the state has decided to move to Tier 1B. As the state allows vaccination groups to move on to Tier 1B, we will prioritize our staff who have been working in person, our staff reassigned to our childcare sites, our MSCR staff, our custodians, our food service workers, and others who've been in person throughout the pandemic. Immediately after that group, we will move on to our elementary staff, all elementary staff who have yet to be vaccinated, followed by middle school staff, followed by high school staff, and then last, our central office staff and our substitutes. We are working closely with public health to make sure that we understand their intended process, and we're also continuing to work with a couple of other community agencies so that as soon as the state gives the okay to move on to Tier 1B, we want to be prepared and understand the most efficient means to get all staff vaccinated. But working through those priorities, we want to take care of our staff who continue to work in person today, followed immediately by our elementary staff.
And I would just add to that too, Scott, it's a priority. And I think as we're trying to just move forward as a community, not just here across the country, we have to prioritize our entire staff to get this done. So again, I just encourage you to assist us in this, and by you just contacting whoever you can to assist us in getting this done. Our medical advisors, in terms of, if you have any thoughts on that particular piece about the vaccinations, if you would speak to that, Dr. Henderson, Dr. Wall.
Yeah, this is Ellen Wald again. I think that we have all, tried to advocate for the teachers to get immunized as quickly as possible. These decisions, I think, are above our grade level. They're really coming from the Department of Health Services. And so I think we have certainly, both UW as well as individuals, have written many letters to indicate that we believe that it's appropriate to prioritize the teachers and all the staff of the schools, so that everybody feels as safe as they can.
I do want to just add to Scott that the board has been advocating for prioritization of the vaccines to our teachers as well, sending letters and so forth. So we have been advocating for this as well.
Thank you all. Are there plans for after school care or child care, including on the asynchronous Mondays?
Yes, and with this particular one, I would like to have Ms. Dyer speak to what we're doing with our MSCR, and then we'll also have this join in assist that. Ms. Dyer.
Thank you for that question. Yes, MSCR, as well as some of our partner providers who are currently doing all-day childcare in our buildings, will We are moving forward and planning to do childcare, after-school childcare in many of our elementary schools. We do not have a 100% commitment right now for all of those schools, but we're working toward that.
That was a great question because that's been a big question amongst a lot of the parents. So thank you for that question too.
And sort of related, what is the plan for MSCR Cares since those have been located at some of the elementary schools that will now obviously have students in them?
Yeah, thank you for that question as well. We are moving CARES out of elementary schools into our middle schools that do not have adjoining elementary schools, just so we can spread students out. And so our plan is to serve 3rd through 5th graders at the MSCR care sites in middle schools, as well as the Allied Learning Center, starting with the first day of in-person instruction on March 8th.
Thank you so much. What is the plan for dealing with positive cases, testing, and quarantining among students and staff who will be returning to in-person?
So Nurse Sally or Jay, if one of you want to respond to that, what we've been doing and what we will do?
Yeah, thank you again, Scott. We've had quite a bit of experience actually through from last summer and then all the way through the fall when community rates climbed significantly, where we were faced with positive cases of either staff or students within our childcare settings. We've developed a really pretty thorough process that we now have quite a bit of experience with. And so whenever we learn of a positive case in one of our schools through our staff or students with disabilities who are currently in person or through our childcare sites, they report that either directly to their school-based nurse, their principal, their site director, and then they report directly to our health services team at the district level. One of our lead nurses then takes over the process and does contact tracing to determine exactly who would have been exposed following the CDC guidelines for close contacts. And then thereafter, we make a decision. Our health services team makes a decision based on a number of factors. They would look at number of student close contacts, number of staff close contacts, number of student absences, number of staff absences, and then a couple of additional factors, the extent to which students or staff are crossing over outside of their cohort groups, the extent to which safety precautions are being taken, mask wearing fidelity, et cetera. Also taking into account public health data and the degree to which there's community spread, and then any other community concerns if there were other exposures in that particular school community. Looking across those variables, then we make a determination on whether it's just impacting a few individuals within a classroom for close contact quarantine, or if it's shutting down an entire classroom, a couple of classrooms, or in some cases, the entire program and or the school building. We're going to plan to use the same exact process as we reopen our schools. And again, we believe it works, and we believe that the variables and the factors taken into account are right. And then as soon as possible, we reopen our schools safely. And so we're planning to use that same process as we move into reopening our schools. And Sally, I'll turn it over to you if I missed anything there.
No, I think you said it very clearly, Jay, but we've been doing this work since June when we reopened our MSCR Cares program. And I feel like our nurses staff, lead nurses are all very well trained and, in doing the contact tracing. And we feel confident we can do that as we reopen schools.
Nurse Sally, could you also speak to the assessment? Because that's been one of the big things there, Scott, out there amongst my colleagues. How are we going to go about doing testing, assessment of our students in the schools as well, and what we're piloting right now?
Yeah, currently we are piloting a program through Qualtrics, a symptom screener, and that all our staff and students and families will take prior to coming into the school building. And, it will assess if you have symptoms, if you've been in close contact, or if you are positive for COVID-19. And so if you would, respond yes to any of those questions, we'd ask you that you stay home, and they'll most likely be a follow-up phone call from one of our nurses. around that. So this is just, the CDC really recommends a family screener when you're returning to the building. So this is kind of what we're planning to do. And we again have used a similar program through MSCR. So we're, and have had good results with families filling it out. So, and staff.
Thank you.
Thank you all so much for that detail. Will any other school operations, whether school board meetings or central office staff, be working in person once schools return to in person?
I can say, Scott, that the school board does plan, we're already making arrangements to meet in person, and we're working through those logistics right now, what it would look like, how many people that we can allow in the auditorium, and making really just playing those safety precautions. So the school board will be meeting in person as soon as we all get in person. Probably it'll most likely be the March meeting, depending on where we're at with logistics.
Yeah, and as far as the central office, we've had many people never left that's been working, but we also have to be very conscientious about the capacity of the building. So we have a return to building coming that's going to be led by our various leaders, managers in central office.
All right, thank you. And then my final question, do you anticipate at this time that all grades will be in person by the end of the school year?
What I can tell you right now, based upon the metrics, we do not try. Would I love for all schools to be back by the end of the year? Yes, but we're going to stay with our metrics, stay with our internal, external advisory, listen to the medical advice. The science dictate this, and as it's appropriate for us to do phase in, we're even beginning to look at co-curricular activities and what it says in terms of the safety around that. So we would love to say that, but I can't tell you that, because if the situation changes, just like even with us beginning to open, if things just, go astray, we're going to have to make a decision to be safe.
All right, that's all my questions. Thank you.
Thank you, Scott. We'll turn now to Gabrielle Rusk with NBC 15.
Good morning. Thank you for taking my questions. I have a question regarding the vaccinations of teachers. Does the district know if there's a percentage of those staff members or teachers that are considered phase 1A, what percentage has already been vaccinated?
I have Jay. Yep.
Yeah, that's a great question, and we don't have that exact percentage. Recognizing that the state has sort of rolled out group or tier 1A over a period of weeks. We believe that those who were first added to the group, our nurses and our nurse assistants, have completed it and worked through it. Groups of staff that were added later in the process, we believe are still waiting. It's a little tricky because we don't have a great way of surveying our staff to identify exactly where they are in the process, but we're working to develop that so that as we move on, especially to tier 1B, we're able to reach out to staff to identify where they are in the process in terms of waiting for their first or their second dose. But to answer your question specifically, my instinct is that we are nearing the end of our staff who are in tier 1A, but I don't have specific percentages for you.
And then as a follow-up to that, do you know if there is a number of teachers or staff who are opting out of getting the vaccination for any reason?
It's another great question. We've had quite a bit of conversation with our medical partners, especially around vaccine hesitancy. And we know that for very good reasons, there are a number of staff who may be apprehensive. And despite those concerns, we're hoping to work through that and understand the safety of this vaccine, the effectiveness of this vaccine, and working with our health partners, hopefully to provide additional information so that our staff can make an informed decision based on all of the factors and the data that exists around the vaccine. Similar to where they are in the process, we have also not asked our staff if they intend to. Our plan was to wait until they have the opportunity to, and if they don't, we will learn that later afterwards to avoid another ask of our staff to share information with us.
Switching gears, Dr. Jenkins, you had mentioned that you and other staff members with MMSD traveled to different districts in Wisconsin. What did you learn from them that they were doing well that worked? And what specifically have you taken from, I guess, talking to other districts who have been in person that you're now applying to MMSD?
That's a great question. Besides just looking internal, we did go external. I'll have our elementary school chiefs talk about that who were leading the visits, and our other chiefs as well. Yeah.
Afternoon. So yes, we did have the opportunity to visit other districts to see what was working well. We had the chance to speak with principals as well as teachers to learn best practices, everything from what safety mitigations they had in place as far as how students were walking down the hall, to how they intentionally focused on social and emotional well-being of staff and students, and what things they implemented to ensure that safety, relationships, and social and emotional well-being were priorities when bringing students and staff back into the building. So we were able to look at instructional models such as the concurrent model, which is the model that we will use in MMSD, in which teachers will instruct both students virtually and in person at the same time. We were able to see how they implemented specials in their buildings, how they implemented, again, the safety procedures as far as how students were spaced in the classroom. And also, just the best part about it was just being able to see the joy and the welcoming environment that was created by staff, and how happy students and staff were to be back in the building.
Additionally, as we learned from many of the buildings, there's so much opportunity that comes with the reentry. There's the opportunity for innovation, to think creatively about the instructional design and support of students. As Ms. Stanford clearly said, the social emotional supports, and really elevating that work around social emotional learning and support of one another for peers and for educators. And we also know the importance of mental health and mental health supports, and having students in our within our view, which we can support their mental health and understand their needs. Those are all things that really came to light. It's very clear that we want to make sure that the traditional classroom that we once knew, that is not what the students are returning to. And we are able to see models of that, learn what that experience is about, but really clearly articulate that there should not be an expectation of what we knew as a traditional educational setting is what our students will return to. The concurrent model of teaching is instructional design, which will have students in person and those that choose to remain virtual in that setting receiving the same instruction. So if anything, I appreciate the words that Ms. Stanford said around the supports and teachers taking care of each other and staff taking care of each other, but also the joy that we really saw when students return and were able to interact with each other appropriately, social distancing, but also the joy with teachers being able to interact with the students that they miss so dearly. Even though we know we've engaged virtually, there's nothing like that appropriate proximity contact that you're able to have with a student.
I'd like to add a few things on there. First, we want to thank Verona and Sun Prairie, Middleton, Wanakee, Oregon, and Monona Grove for extending invitations for us to come out and see their schools. To add on to what Dr. Clarity and Ms. Stanford said, we were able to see how students entered the buildings. We were able to specifically watch during transition times to see the safety practices that were put in place. We sat down with teachers as well as with counselors to talk about what they've learned in scheduling. We sat in classrooms to see how it was socially distanced and to observe how teachers were able to interact with both students concurrently in person as well as online. And I think the final one, and I know it was said twice already, but I need to highlight this. We saw some smiles from adults and we saw some smiles from students. We forget it's been a year, the joy of walking down the hall and feeling the excitement from everybody involved, that school spirit It's something that we're excited about, something that we'll continue to do, but it goes to show that Dane County's strong and wants to support each other in the return of schools or students to schools. Dr. Pryor, would you like to add anything?
Yes, Mike, thank you. And to my other colleagues as well, thank you for lifting everything that you lifted. You're definitely spot on. One of the things that I would like to add to that was that in our planning, and we've been planning for a minute here, these visits allowed us an opportunity to kind of validate our thinking. We were able to see concurrent things across the board and other districts that they were doing that was totally in alignment with our thinking here. So it was a sense of validating our whole thought process. We were able to see systems in practice. You know, some of the same systems that we're elevating here, we had an opportunity to see those systems in practice and had a chance to see how the teachers and how the students were pretty much, they were so intentional in adhering to the guidelines and the practices that were set forth for them. I have to join my colleagues in saying this. It was a wonderful sensation being in the midst of children and teachers again in the buildings. And I was very thankful to many of the staff that lifted the idea that there were many apprehensions. There was some anxiety that exists prior to re-entering the buildings. And they talked about how quickly that dissipated. And I really think it's going to be the same thing here. I think our superintendent said it best, that this is new territory for all of us. You know, we're working these things out in real time, and we're also prepared to make the adjustments that we need to make in real time to make this happen, because, you know, this is going to be with us for a while, but we have our best thinking, and we were able, I think, in an advantage is that we had an opportunity to observe others and learn from mistakes perhaps they have made, so that we will not venture that same path. So we're very confident about what we have in place. The elementary team has done a marvelous job in preparing, and the secondary side of the house have learned a great deal from them.
I would just like to add as well, just a thanks to Stock Prairie as well. We did have the opportunity to visit them, and one of the very unique things that they had that stood out was their intentionality around social emotional well-being of students. So across the board in their elementary schools, they made sure that social emotional health was addressed through morning meetings. In their middle schools, there was a class that was developed around social emotional learning. And then also in their high schools, they extended their first period of learning to focus on social emotional health as well. So again, while we've had the opportunities to learn from our MSCR CARES program, and also just the tremendous work that leaders have been doing during the year to prepare us for reopening, it was great to be able to go and collaborate with other districts and to just use our strategies or to make sure that we're on the right track for what we're thinking as far as our practices and strategies that we will employ for reopening.
Any other questions?
Can I add one
no,
thing in closing? And I'm sorry, but I think this is very important, you know, because, and I'm surprised it hadn't come up yet about our co-curricular courses and extracurricular activities. You know, one of the things that we learned from many of our neighbors of how they were venturing that, like band, you know, we know about the aerosol from that, but they still had classes, but it was more separated from theory and practice, if you will. It was more theoretical based. And then the students completed their learning at home, where they submitted samples of their playing or their performance to the teachers to receive feedback. And so those are some of the things that we're taking into account as well. The social emotional piece, again, has been lifted. It's paramount. You know, I can assure you that as we transition back, we probably will not be jumping right back into the curriculum, because we realize that there has to be a lot of work around social emotional support for our students, and we're prepared to do that and make that an integral component of the teaching and learning process.
Thank you very much. Those are all the questions I have.
Thank you, Gabriella. Now we'll turn to Jamie with News 3.
Yeah, just a couple of questions. So as we get further into this vaccination process statewide, eventually, as mentioned before, teachers and kids will eventually allowed to be vaccinated. Does MMSD plan to do anything to keep track of how many people have been vaccinated or who has been vaccinated? Or are there any metrics in place for when that happens?
Yes, Jay started speaking to that. Jay, could you go ahead and reinforce that?
Yeah, just to follow up, we do plan to survey our staff. Obviously, because we're requesting personal health information, that information would go exclusively to our human resources department. But we're making sure that we're asking the right questions. But it's obviously important to us to be able to track where we are in terms of working through our tiers and successfully getting all staff vaccinated. So to be clear, we do plan to survey our staff. We're working through the details of the best ways to do that so that as we work our way through Tier 1B, we're able to track our progress.
And the second part of that, Dr. Henderson or Dr. Wall, could you speak to children being vaccinated? Because there's different information out there and conflicting information about how long that's going to take. And so if either one of you could speak to that particular piece, students being vaccinated.
Well, at the moment, the vaccines that are under emergency use authorization are for ages 16 and up. And unless they're under regular, they're not up immediately for vaccination. There will be trials for younger children ongoing, but we're still looking at months in which there's going to be information about vaccinating the students, especially those under 16 years of age.
Thank you.
A follow-up question that I had as our live stream is up, there's a lot of parents who are asking how the in-person and virtual will happen simultaneously. Can you address how that will work?
And that was definitely a big question amongst us. As I talked to my colleagues, they really did assist myself, but also our team had an opportunity to go and observe that. So elementary chiefs, if you could speak to that, please.
Yep, so as we stated in the concurrent teaching model, teachers will instruct students both in person and those that have chosen to stay virtual at the same time. So the concurrent model will help us to maintain relationships by keeping classes together with the same teacher, and also provides one classroom community, allowing virtual students to participate in real time with their in-person peers. So it also ensures that we are providing equitable instruction by not creating two different student experiences based on if a student is virtual or if they are in person. So students will experience whole group instruction together as a class. There will be small group instruction that they will experience that can be a mixture of some students that are virtual and some students that are in person. And they will also have an opportunity to have independent learning take place as well.
Thank you, Ms. Sanford. Just want to also clarify one of the questions that we get consistently, we want to put into the space now is, will the in-person student always be tethered to a device? And that is not the case. So it's not picking up the virtual and moving it into the classroom. It is in-person instruction as Ms. Sanford laid out, with independent work, group work, and whole class instruction. But I just want to make it very clear in this space that it's not a situation where an in-person student has to be consistently tethered to a device. We understand that is a concern and want to clarify that.
Thanks. And then my last question is just, what's the biggest change that students and teachers will see once they return to the building for the first time in a year?
I think from my vantage point and having gone to other places and just talking to my colleagues, when they come in, we may see there have been some lessons learned during this whole virtual time. We are going to see an increased usage of technology. We had talked about this before the pandemic hit, and we were thrown into crisis learning last spring. Now we've actually been able to look at our instructional model and take some really good things out of this. And I think for the students coming back, it's going to be a different experience as we're trying to mitigate for safety, and they won't be able to have the normal lunchroom experiences. The things that we think are small, but make up the schooling experience is huge. At the elementary level, you normally have staff at the front door. And when students get off the bus, they're there prepared to hug a student, bring a student in, that touching piece, some of those things that we're going to have to do in terms of mitigating, because we're still in a crisis. We can't just go back normal and have excessively large classrooms like we've had in the past. Even down to our co-curricular activities that we're beginning to explore right now, they won't look the same. But I often liken this to 9/11. 9/11 happened, and the world, we had to kind of adjust. And I think that students will do an excellent job. I have all the confidence after been talking to students. They will be able to make the adjustments. We're going to be able to make the adjustments as a staff, but everyone must know this, parents in the community, we must continue to have safety first at all costs. Safety must be first. And I think the learning, what we're looking at, and we were just talking about it yesterday, some of the innovation that's coming out of virtual will to pass back into the classroom. As a district, we're also looking at virtual campuses moving forward, not just having the traditional learning as we've had it. We have a number of students who are medically fragile, staff medically fragile. Out of a crisis, we have learned quite a bit, and we look forward to implementing that as we go back.
All right, that's all the questions that I had. Thank you so much.
Thank you, Jamie. Channel 27 and Spectrum News are indicating they're going to pass. So we are going to circle back to a follow-up question from the Wisconsin State Journal, and we'll bring in Beth Byer.
Great, thank you so much. I've had a few community members reach out to me over the course of this press conference. So one of them asked, when will Doyle administrative staff return to buildings full time? And can that administrative staff help to support in-person classrooms?
That's a great question. We talked about that throughout. One of the things that we want to make sure is that we follow the guidelines for how many people. If you see some of the office space in Doyle, people are literally sitting on top of one another. And so we have to be careful about how we do that. We've had Doyle staff in there present throughout this whole time, but we've had to have limited how many people we can have in a particular room. We're ready to go back. In fact, we're looking to go back, but we want to make sure that we're safe. We have to make sure that every student, every staff safe doing this. And everything Dr. Fauci has said, and all the other doctors, our medical advisors, we can do this as long as we do the mitigating strategies. We can't just drop the mitigating strategies. It doesn't matter if it's in the bus garage or if it's in a classroom or if it's at Doyle.
Okay, great, thank you. And another community member question. From my understanding, the March 1st date for teacher vaccination is a target date and not solid. So does this mean that Madison elementary schools are reopening without confirmation that all teachers will have the opportunity to be vaccinated first?
It's not just Madison schools. We have schools right now who are fully operationalizing, and they're back 4K through 12. We understand if we do the mitigating strategies as has been suggested, that we're going to have a safe return back to school. So the date in terms of with the vaccinations and all of that, that's a part of the safe return to school. But we have our staff serving our special needs children who are receiving services, they're back now. We have our MSER, they're back now. We have our custodians, they're back now. So we're trying to make sure that it's as safe as possible. We're going to continue to follow the recommendations of our medical advisory team. And I would say the same thing to you I said to Scott, help us out. Tell the legislators, tell the governor, we need it now, yesterday. That's what I would say. The vaccinations.
Great, thank you so much. And last community member question, is it possible to continue to use online only learning until all staff and community members have been or have had access to the vaccine? And if so, why open schools now with just months left in the school year?
I think There are several things to that particular question. First of all, thank you for asking that question. And we've received it quite a bit, but we're trying to give our staff, we're trying to give our students, parents options. As we're going back, reopening, there will still be an opportunity for parents to select the virtual option. At the level and at the phase-in approach that we're taking, it's going to be safe. Safety is first with us. Could we continue to go just online? I guess some are continuing that for whatever reasons that they may have chosen. We're trying to take into account not only just returning safe for the instructional side, but there's a socio-emotional piece that happens in schools that's huge. And we want to support our students, our staff, and our families in doing this. And so at this time, this is the decision that we're making that's best for MMSD.
Great, thank you. That's all I had.
Thank you, Beth. We have another follow-up question from the Cap Times. Scott?
Thank you so much. First one is, why did the district decide to go with the 2 full days a week for 4K?
And I'll have one of our chiefs respond to that, or Lisa.
2 full days a week for 4K allows us to implement a full day model for 4K students. And so they will attend full days either on Tuesday, Wednesday, or Thursday, Friday. Our old model or previous model of 4K was half days. And in keeping in mind the safety procedures that we needed to have, we were not able to provide half day instruction for students and also implement safety measures.
Thank you. I appreciate that. And then my other follow-up, is there any protocol or plan in place for if students aren't following the safety protocols, the distancing or wearing a student who's not wearing a mask, what are staff going to be directed to do in those situations?
First of all, let me just say it's school and we have children, right? Our job is to make sure that our children are making good choices each and every day. So in terms of the response, our initial thing is going to be to get them back. And we're going to work with not only the students, but with the adults too. Sometimes it's difficult, as you and I both, we're out in the community. We see some adults not doing it, but it's our job to reinforce and have the students understand the importance of why we're having them participate, not just in the mask, but the washing of the hands, all of the mitigating strategies. I think this is a perfect opportunity for us to introduce to our students global understanding of their responsibility to their community themselves. And so right now in MSER and our other programs, we see that students are too responding exceptionally well. In the beginning, all of us are going to have to continue to work on that.
Thank you. Those are my questions.
Thank you, Scott. Now we'll turn it over or we will open it up to the room for any follow-up questions from any of our reporters here today. With no further questions, Dr. Jenkins, I'll turn it over to you for your closing comment.
Just once again, I'd just like to say thank you to everybody, to our community, especially, and we just wish we all could be in a better place, but we have been able to do this work. And I know that I've received many, and the board, we've all received many emails both ways to reopen, to remain closed, but we have stayed true to the metrics that we have put in place, and we've listened to our excellent world-class medical advisors to make sure that we can bring our students and our staff back safely. We think we're at this point to do the phase in. And that said, that's what we're going to look to do. But if at any point the metrics change, CDC, public health, recalibrate, and things are not going in a positive direction, we will do as we've done in the past, make the necessary changes to ensure the safety of everyone. Thank you so much. And thank you to our team. And parents, please know that you have a very dedicated group of individuals trying to ensure that your children are safe. And thank you to everybody.
Thank you.